slowly.
All right, so we welcome you to join our conversation in the chat. And if you leave a comment, it's possible that we may call on you and unmute you so that you can speak up with your voice and or video if you have that going. And this is a continuation of the conversation that we started on Friday. Thank you all so much if you joined us on Friday, and if you're back again, we so value all of you. And we think that now it's as important as ever to be talking about ACEs science. So I'm going to turn it over to our founder and publisher, Jane Stevens.
Hi, everybody. Thank you for joining us. This is kind of the next step in our putting together this series of brainstorming or webinars or whatever we're going to call them. We can be really flexible as time goes on with this. I'm actually kind of glad that we have a small group because we can actually have more of a conversation. So I'm very happy with that. I did want to read you something from a New York Times article just to start, which sort of set it off for me as far as the opportunity we have here to make some big changes in our country. And this was from yesterday, and I'll put the link in the chat and also in the notes on this. The headline was COVID-19's economic pain is universal, but relief depends on where you live. And in it said, in a Queens apartment in New York, a laid-off busboy has no idea if he will make next month's rent or feed his family. An out-of-work waitress in Amsterdam, however, can count on the government to cover 90% of her wages. And the article goes on to describing the disparity. And I'm sure you already know people who are wondering about what they're going to do since they have absolutely no income and are living paycheck to paycheck. Here are some things that are happening in other parts of the world. In Copenhagen, the Danish government has promised to cover 75% to 90% of salaries if businesses don't lay off their employees. Another one, Netherlands will pay up to 90% of wages for companies hit hard by the pandemic, with extra provisions being developed for restaurants. So it's that kind of thing that's happening in other countries that are, I think, are good examples for us and how we want to change our system so that when we face this again, because it will be a when, not an if, that we have some things in place that are very different from what we have now. So let me go back to Zoom. If you have any questions about that piece, and then I want to read you something from Becky Haas, who was on the call on Friday. She can't be with us today, and I'll tell you why about that in a second. Do y'all have any questions about or comments about the New York Times article? No. Actually, with only 14 of you, I can actually scroll through quickly and see if there are any. But for the people who are on the phone, just shout out if you have a question as we're going through this.
Yeah, if you type your question in, if they're on the phone, I see. Yeah, at the moment we probably won't. I mean, I guess I could unmute people, but I think we have just a few too many participants for that. So I apologize to those of you who joined my phone.
Okay, so yeah, just put your question in, and then we'll unmute you so you can do follow up if you want. So the email I wanted to read you from Becky. Becky Haas works for Ballad Health in Tennessee, Johnson City, Tennessee. Ballad Health has, I forget, a couple dozen hospitals and clinics in 3 states, I believe. And she's been doing their trauma-informed work for a long time now, but relatively long time for a health organization. And she said she's been pulled out of her normal duty to answer the barrage of calls coming into the virus screening line. And her shift is from 3 to 11 p.m. in Tennessee every day, so she can't join this call. She said that she reached out to the spiritual director with concerns of our team members growing exhausted and scared. He created a code lavender room in our largest hospital with coloring, meditations, and calming activities for staff. Their CEO sent out a thank you video to their 15,000 employees. Becky's sending out links to corporate marketing to share on social media feeds for tips on how to keep kids calm during this time and how anyone can de-stress. And she says, in my phone, answering for 8 hours a day, I try to share simple things that people can do to de-stress, like to practice deep breathing, take a walk in the outdoors, use technology to visit a family member or friend. As hearing the anxiety in caller after caller is unlike anything I've ever experienced. So there's that part. Any comments about that? Are you all experiencing some of the same things?
If you're on video, you can, and you want to say something, you can raise your hand. And then if you're on chat here, you can just kind of say, I have a comment, and then I can unmute you. So feel free to chime in if you would like.
Okay. Great. And the third thing I wanted to do was just to share with you, I went through the entire chat from Friday. And so this is some of the feedback that we got and things that people wanted. As far as topics that people wanted to either talk about or get someone to talk, that we bring in to talk about, so supporting families during social distancing, substance abuse prevention and the quarantine, first responders and their trauma, community trauma issues such as racism, fear and beliefs. Fear drives people to be much less social and much less generous, and just terrified to do anything, and also leads people to getting an oversupply of guns or toilet paper, or all of those things that we have done to one extent or another. As we're reacting. But I think it would be good to have somebody come in and talk with just about fear and how to address that when people are having a very hard time coming back from slipping into fear all the time. Other topics were self-care and burnout signs that you can detect via Zoom, because that's the way we have to detect them now. Or through writing, I guess, communications anyway. Domestic violence, obviously, programming for communities. How can we continue to do that, especially those of you who are in ACEs initiatives in communities? How to continue providing services. Allison Johnson asked that, and I wasn't sure what services Allison was talking about. I don't think she's on the call today, but so I'll reach out and ask. Socialization needs of people with mental illness, and ACEs score and screening, interestingly. So
we have one person who, Florina says that she has a comment. Would you like to take that now, Jane?
Okay.
Okay, so I'm going to unmute you. Let's just see if this works. Okay, great. Florina?
Hi. Can you hear me?
Yeah.
Yes.
Hi.
Hi, Lorena.
Hi. So I'm from Family Advocates, and we have 2 different departments. We have our CASA program, right? So the Guardian Ad Litem program. And on the preventative side, we have family strengthening. And I'm part of the family strengthening department. And so our goal is to end child abuse by prevention, right? So we normally, before all this happened, we would hold parenting support groups based on the curriculum is based on ACEs, the 5 protective factors, and positive experiences, right, for children. And when this began, we got a couple. So we've been this is our second week at home now, but we've been thinking a lot about our families, just because, you know, they had needs before, like they were struggling. A lot of our families were struggling before this began. And so we know now that it's worse for them, right? And so we have part of our group, they would earn concrete resources like diapers, wipes, school supplies. And so we thought about the best way to still get them their basic needs without kind of endangering everyone, right? We're trying to keep in mind the social distancing. So what we came up with is we have a private Facebook group for just the families that have attended, and we had them call our phone and say if they needed something, and then we made deliveries. So we're starting to do that, delivering every Friday, and we just go to the door, drop it off, knock, and then kind of back up and, you know, make sure that someone's like waving through the window or something before we leave. And it's very different from what we were doing before, but we're trying to make adjustments for the group as well. We talked a lot about online, but we're trying to figure out what to do for those families that don't have access to internet or Facebook or a printer to print out activities. So that's kind of been our struggle.
Okay. Does anybody have any suggestions or any ideas, anything that they've run across?
Thank you so much for that comment. Okay, so yeah, I saw some waves. Lucy, did you wave? Okay, I'm going to unmute you now. Shoot. Okay, yours is not.
I think I got it.
Oh, you got it. Great.
Okay, there's one community that's providing prepaid cell phones to people who do not have access to phones, which I thought was a great idea, to just be able to even contact them on the phone. I'm not sure that it has data capabilities, but so I would share that.
Thank you. That's great. Maybe it's useful for to have just a discussion about this and get people's best ideas and promote it as that, so that we can get a lot of folks from ACES Connection who are just in this arena. Is that something that might be useful?
Yeah, I think that would be great.
Okay. All right, good. We'll do that. Thanks for all that information, and we'll also be posting it in the blog post that we do about this. So, but these are some good ideas. Any other ideas that you all have? What I was as far as like topics, and then I'll go on to the format piece of it.
This is Laura, and I'm sorry I just now joined. I was trying to get my kids settled. So I missed what other people have proposed. If your question was what topics do you want to address, I have some ideas, but they might have already been said.
Oh, go ahead.
Well, I just started on Thursday working for the state of Alaska, the Division of Public Health, specifically helping make the COVID response trauma-informed and culturally responsive. So I need ideas for that. One of the first tasks is to look at the section of public health nursing, their testing protocol, and how to help them make sure that the way that they're writing the protocol for clinics across the state to use is trauma informed, and also the materials that they're going to give people to take home and read while they're waiting for their test results, or the people who screen out and aren't tested, and kind of how to help people deal with that. That's some of the immediate needs. The other things are working with the state to figure out domestic violence and child maltreatment in the context of people isolating, appropriate messaging to different communities. But yeah, most immediately kind of thinking about how to support the efforts so that everyone who needs testing can get it and not be scared away, and so that people don't feel further traumatized by the process of waiting for their results.
Thank you, Laura. And why don't you tell folks what you were doing before you took this job?
Sure. I spent the last 4 years as the director of the Alaska Resilience Initiative. So I was at a nonprofit called the Alaska Children's Trust, connecting people from government and tribes and schools and nonprofits and communities who are doing trauma-informed work. And we did things like legislative advocacy, got a trauma-informed statute passed, created curriculum.
Great, thank you. I think that probably we'll be checking back in with you, because I think that you're going to be a great wealth of information as you all put this out. I don't know many states that are taking this approach, so I think it's
really. I just realized I had double booked myself. Is this conversation happening every day? Did I understand that correctly?
Either this conversation or a conversation is happening. Like tomorrow, there's a webinar that was already planned, so we're not going to be competitive with that. That's actually about practitioners and how to deal with this. So, but it'll probably be Tuesday, Thursday, and Friday at least, and maybe Wednesdays will be something else. So we'll see. We're very flexible. We're making this up as we go along, like everybody else is.
Well, and at the same time, we want people to know that they can tune in, daily at this time. Tomorrow will be the ACEs Aware discussion, and we'll put a link to that in our blog. But then you can kind of count on same day time and same Zoom link Tuesday through Friday. And most likely we'll do some next week. It doesn't seem like this pandemic is going to be gone by next week. Just thinking.
Mm-hmm. Okay. I may have to go on to another meeting early, but I wanted to tune in for a little bit.
All right. Thanks, Laura. So Lucy had a question. Do you want to go ahead and ask that, Lucy?
So we're working with a group of early childhood professionals to support families and meet their needs now. And one idea we're looking at is guiding the group with essential questions. And so the first questions that we're working on putting together is kind of putting the spoke in the wheel and saying we don't need to flood families with a bunch of resources. We need to kind of slow down and help people get grounded first. And so we put together these questions, and I'm just curious to hear some feedback as to how do we address this as ourselves? Like, we need to go through this process as leaders of the field to be able to support families, and then how do we transfer that knowledge and that experience that we're going through to share that with families getting established in their homes?
So is there anybody else on the call who's been dealing with this, who wants to answer? Well, if you're typing something, I'll go ahead and say a little bit about what I've seen out there that might be useful. Is these some of the short videos, or that just to be specific, that his name just went, Judson Brewer is doing. He does unwinding anxiety, and on his we just posted a blog about that talked about what he's doing. He's doing these very short videos about how to what is happening in your body and brain when you're very anxious, and how to kind of get a handle on that. And so they're not very long, and he does a fabulous app called Unwinding Anxiety, which I have used over the last year, which has I didn't think I was an anxious person, but I have to tell you that after I started using the app and going through it, I had people in my team say, "Gee, you seem so relaxed." And so I didn't realize I was so tense, but it really works, and there's the brain science behind it. So it explains exactly what's happening in your body, that, you know, what a panic attack is, and you're not having a heart attack, and things like that, that I think are, you know, you can start saying, am I really in danger? And you can start asking questions, and in that process calm yourself down. So I think those are pretty useful. And there's so there's the brain science behind it, which is you know, it works for almost everybody. So that helps. And then as far as, I think you can probably get ideas from different people on what they've put into practice, and certainly get it from not only from this group here, from lots of people on ACES Connection, especially in the Practicing Resilience community. So that's handy. Anybody else have good resources or ideas?
Okay, let's
Elizabeth
see.
Grady.
Yeah, so let me unmute you. Although I think you can unmute yourself, Elizabeth, if you would like to try that.
It's Beth, and
Okay, Beth.
I was just gonna read. Yesterday, I saw a webinar with Dr. Bruce Perry, and one thing that he reminded, I mean, I'd seen this graph before, but about how predictable exposure to stressors can actually increase resilience versus random exposure to stressors sensitizes to stress. So I've just been intentionally deciding, okay, I'm going to have a schedule of when I'm going to check the news, once a day or twice a day max. And I'm going to sort of make it intentional, like, okay, I'm doing this and it's going to be horrible. And it's actually been a lot better. And then the other thing I was going to type is the Monterey Bay Aquarium that has, if you go to YouTube, they have a guided meditation with their moon jellies. It's amazing.
Oh, that sounds amazing.
That's
cool. I actually have tried to use their jelly cam for, mindfulness before, but now they have this thing with like a script. So it's really cool, and music.
Wow.
That's great, Beth.
Hi.
The Elizabeth threw me. It's nice to see you here.
That's how I'm like zoomed, categorized or whatever.
And then we also, Florina had another comment, and you're welcome to go ahead and unmute yourself and chime in here.
I just mentioned to Lucy, I think it's a great idea to help families stay grounded. We kind of had the same intention, right? There's all these things going on and everybody's providing resources, but we just, we know that our families kind of are just struggling with basic necessities and trying to keep their kids calm. So we're trying to share those activities. We set up a Google Classroom. Again, we're just trying to figure out what to do with those families that don't have access to internet. So we thought maybe we'd print off some things with our deliveries and then stick them in those packages as well, to give, and then, add some colored pencils and crayons and things like that, because we have plenty of that stuff. But we've also talked about possibly live streaming activities, just so that we can have some interaction with those families from a distance. But again, that's just dependent on their access and whether there's interest for that or not.
Thank you. And Beth says there's a big need for resources in Spanish.
And Christy has a put some information on here too.
Okay, here we go. So Christy, if you want to go ahead and unmute yourself, we would love to hear from you.
Yes, thank you. Thank you so much for the opportunity. So what the organization I work for, A Window Between Worlds, we provide training, resources, and curriculum for folks that are utilizing healing art workshops with trauma survivors. And so we realized that we really needed to take some of our workshops, which can sometimes be lengthy and require a lot of different art supplies, and just make them into easily printable one-pagers that each workshop series or each workshop builds upon the next. And so we just released week 1 of the workshop series today, and I included the link there in case someone wants to check it out. And as all of you probably do as well, you know, we got to start with safety, provide that foundation. I always like to say, you know, art is a muscle, and it's a right for all of us, and we can't exercise that muscle unless we feel safe. And so the first workshop just is having folks talk about their safe home, but then also creating community agreements. And that this is just week 1, and each week will intentionally build upon the next. And indeed, folks not having connection to internet's been a great barrier. But I was actually, for those that don't, I was actually just in a Zoom meeting earlier today with a partner who is facilitating via Zoom workshops with domestic violence survivors. And if the folks are still living with their abusive partner, they're going to a park, and you can download the Zoom app on your phone, just like much of the folks are doing today, and they do the entirety of their sharing in the chat box. And she was sharing that even though those folks aren't able to actually create the art, just being able to stay connected has been really helpful for folks. And so just wanted to share that as an offering and a resource. And if anybody's interested, you can check out our website, subscribe to get those weekly emails with that workshop series, because this is just week 1, and we're going to continue as long as all of this continues. Thank you.
Wow, thank you so much,
Thank
Christy.
you. Wonderful.
D'Angelo had a comment here, and it's pretty straightforward, but if you just want to announce it with your voice, we'd love to hear you. So if you want to unmute yourself.
Hey, good afternoon and early evening for those on the East Coast. It's just basically Comcast, or Xfinity, which is a nationwide internet and cable service, has offered free Wi-Fi for anyone who can access their hotspot. So there's a link in the chat for setting that up. You can provide that to your families, to their children, so that they can access these Zoom calls and other random things needed, homework for online.
Wow, thank you so much for providing that resource.
That's great, D'Angelo. Do you know if the other any other companies are doing the same thing, or we could just do a scan and look? Because I want to definitely put that, as well as, you know, some of the other resources that people have listed here online somewhere.
Yeah, I guess we can check if we add these to our list of resources after this call, we can do a check.
Okay.
Okay, so Laura, we welcome you to unmute. Laura Norton Cruz.
So one thing I found I found 2 things that I think are helpful for your question. One is Child Trends posted a really good kind of compilation of guidance for parents, links to articles that go more in depth with parents, how to talk to kids, how to take care of yourself, kind of frameworks for thinking about it. I found that helpful. I'm in a national program called Culture of Health Leaders, and one of my fellow cohort members in Allentown, Pennsylvania, where they have a Promise Neighborhoods grant, they found that, you know, people don't trust the public health department. People don't trust the messaging. So they've been working on a trusted messenger campaign, and the trusted messengers are delivering both public health messages about, you know, stay home, wash your hands, etc., but also messages about how to stay healthy while staying at home. And so they're getting trusted influencers in the community, you know, everyone from faith community leaders and elders to the, you know, the people in high positions of power in each gang. So Bloods, Crips, Latin Kings, right, Nestaya, getting them to make videos. They're giving them the public health messages to make sure they convey, and then they're conveying it in their own words, in their own way, and sharing the videos on a Google Drive that then the city's pushing out, and they're putting them on their own social media. So people are hearing from their own gang leader or their own pastor how to do exercise at home, how to do breathing at home, how to take care of your kids. And I think that's important.
That's really great. Yeah, thank you.
Thank you.
I also have a, you know, sort of a related question, which is we know that alcohol sales are going up significantly, and a lot of parents are even posting, oh man, my kids are driving me to drink, right? So I'm wondering, like, how do you embed, you know, and there are going to be more opioid and benzo use and marijuana use, and all those things put people at greater risk of dying from COVID, as well as kids being exposed to them. And so, like, how can we send positive, resilience affirming, you know, messages to parents, encouraging them not to use substances in a way that isn't judgmental and that acknowledges the impossible situation that we are all in?
That's a great discussion question. Thank you.
And I see that Sissy has joined us. One of the things that I wanted to mention, jumping off of the Child Trends resource, is that Sissy's been putting together resources in ACEs, in Parenting with ACEs. We also have ACEs in Education, where Laura Kane has been putting information, and we're trying not to make it you know, just like a flood of stuff, but stuff that's really pertinent. So Sissy, do you want to say a little bit about that?
Yeah, we're really trying to focus on, if we're practicing resilience, we're trying to focus more on practices that people can do, you know, including parents, and with families. But then in Parenting with ACEs, we're trying to share more that's about parenting with ACEs, and we've just been sharing a little bit at a time, because I feel like there's so many lists of resources that are coming out, which is great, and we're also wanting to capture that information as well and share it. So we're just trying to figure out the balance of flooding and lists and more resources, and then making sure everything is available as well.
Do you have any examples of?
Like we put on practice on the practicing resilience community, we just had like 8 minutes of shaking that you could do with your family as like a practice. And then there's a lot of webinars which are great, and where people are having conversations, because, you know, maybe what's worked for parents in the past is so different right now. So we're still figuring out what works. So I think the conversations, we don't necessarily have solutions, you know, they're just conversations still and figuring it out. So I don't have as much stories specifics for parents for the Parenting with ACEs, other than sharing where people are having conversations and discussions.
Thanks, Sissy. And I just wanted to say again, like I said on Friday, most of you are probably members of our sort of sub-communities, as well as being a part of our larger ACEs Connection community. But sometimes our members don't know that we have these smaller geographical or interest-based communities. And so I just want you all to know that you can go to our home site and press the button on the menu bar that says communities. It's in the upper left-hand corner, and you can browse our communities. We have different ones by state, and then we have like this one that Sissy manages, which is Parenting with ACEs. And we invite you to join them as you see fit.
And we want to get to Lucy's questions, but first I have a question for D'Angelo, because I know D'Angelo, and I thought that you might have, your organization, All Children Thrive, had to turn on a dime and changing all the things you're doing, because you're working so hard on engaging cities to become trauma informed, and also, it's actually, a bigger effort than encompasses more than just that. But so that must have led to a lot of stress and what you're doing. And I wonder how All Children Thrive is managing all that.
Hey, Jane, thank you. Yeah, so just like everyone else on this call and across the nation, we're pivoting greater than Michael Jordan with a basketball in his hand. So the All Children Thrive team works very closely with communities and really informing cities around being trauma informed, and pushing that out into households, better connecting young people and families, and really getting the message about childhood trauma out. I don't work as close with the team. I'm on the policy side of the house. But they have had to switch everything to online, trying to figure out ways to continue to engage with city officials as they're moving the needle around this trauma awareness. Bunch of things have come up, just like all of us are working on. How do we better support victims of violence, domestic violence, intimate partner violence, kids who are being now put in positions where they don't get those 8 hours away from their abuser, right? So how can we better support them? And so they are looking at innovative ways to use social media, different platforms that we know that young people use. Us old people use Facebook very regularly, but trying to figure out other ways to use social media like Snapchat and TikTok and things of that matter to pull on youth to speak up and speak out. But then also, how do we provide safe ways for young people to report, right? That's for not just young people, but anyone in a position of abuse to report. And so there's a lot of talk going on, I know, with that team around next steps. We feel like, this is definitely something that's with us for some time. But once the smoke clears and the dust settles, we can't necessarily go back to business as usual. So how do we use what we've learned from this? How do we look at COVID in a way that benefits us and not just hinders what we're doing? So the organization is really taking a stand on how do we really create huge policy change, if you will, around what we've learned from COVID. There's a lot of things that we realized that changed, just like we're pivoting the government, the local governments here in California, and the state government nationally as well. We're pivoting very quickly. And so things that we've seen when it comes to trauma around homelessness and abuse and those types of things are being changed with the snap of a finger, where most of us have worked and have advocated for those who are marginalized, and years have gone without these different changes. But now we have this illness, disease in front of us, and things are changing rapidly. How do we continue to keep those changes in place is something that the All Children Thrive team and the state policy team here in California are working on very diligently.
Great. Thank you for that. Yep, this is an opportunity. I think, like I said last time, the Great Flu pandemic of 1918 led to actually public health as we know it pretty much, because they didn't have anything in place to deal with that. So we have to bring that back, plus a whole bunch of other things. So it's a great opportunity. Lucy asked, oh, go ahead. You want to just go ahead and ask that?
Okay, so another question, thank you, I had was looking at how can we facilitate discussions amongst even just already established friend groups in the junior high level to just see where they're at with these changes, and to ensure that when this workload comes flooding in online, that they're have the resources that they need to be successful students, or to have the liberty to say that they can't do that today. And so I just am wondering if that's something that's already existing that doesn't have to be reinvented at this time, or another resource that we need to be working on.
Does anybody know of any resources? Now, are you talking about when you're expecting that soon that there's going to be a lot of online work that the student's going to have to do? Is that because teachers have been figuring that out, or?
Well, they've been flooding the Google Classroom already with like mandatory due dates and just a general lack of sensitivity to the fact that we're in a major crisis. And I've had 3 meetings already with the school district, and we're on our spring break this week, and it's supposed to start full-fledged next week.
So this is we really need something for this online education that's trauma informed. It would be contained in a trauma informed presentation, so that you're always looking at that. Has anybody done anything like that? I mean, this is definitely new territory, but it really needs to be done. Sissy?
The only thing I've heard of is that some schools, I mean, it is a big issue, so I think probably, I don't know if it's being discussed more too in ACEs and education, which I would, the only thing I've heard of is through schools, whether it's guidance counselors or parent associations or PTAs, because I have heard of some parents and teachers pushing back on expecting this to be at all a learning time, because of the disparities in the supplies and access and bandwidth, technology, emotionally. So I know people are discussing it and schools are handling it differently. So I haven't heard of like really super formulated plans other than, you know, examples of principals who are writing to schools and saying, we're not expecting your kids to be, you know, learning right now, or reducing expectations on what's expected. But I know some kids have like a full tilt schedule immediately, and some schools do have guidance counselors doing online support. But yeah, so I haven't heard anything major, but that discussion is definitely happening, because some people are saying this can't work. You can't work at home and parent like in homeschool. And so for many reasons, it's yeah, I have heard about that discussion more again than the solutions, but.
Maybe we can also ask Laura Kane to see if she's seen anything, but that's definitely something to keep an eye out. And Lucy, you might want to just put a question and ask the community section on ACES Connection, because you know, there's people, a lot of people who are on this call that may have are starting to work on that and may have some ideas, but we'll definitely keep an eye on that. The only other thing that I wanted to add from what the chat notes from last week was some people wanted a few more sources, and I think that some of the sources, you know, how to keep tabs on child abuse, I think that A couple of people had some really good ideas today, and I think we'll be gathering those. And one of the things I was thinking about for one of the first topics, since I know people who might be available to provide more in-depth on this, is on domestic violence and also on child abuse. I think in the domestic violence arena, I was thinking about seeing if Nada York could join us, and she's sort of on the other side of the two parts of domestic violence, which is on the perpetrator side, and she's integrated ACEs science-based practices, and in the and the courses have been evaluated in a few places, and she's reduced recidivism from 60%, which is what you get when you do nothing, to in some cases 0 or to 6%. So it's pretty remarkable, and she might have some ideas about what to do in this time when people are so isolated, for the batterers as well as for the victims. And the batterers are mostly men, but there are some women, and vice versa. So I was also thinking of, there's a couple of people I know who have integrated ACE science into their victims programs, and I'll see if they're available too. And that's what comes first to mind that seems to be really important to folks right now. Besides the what do you do with the kids at home, and comforting them during this time. So I think we have that as being pretty well gathered by Sissy, and but as always, if you have any other ideas for any of us, please let us know, because this is all of us together figuring this out.
Yeah, feel free to email me, and I'm gonna put my email here. If you have any topics that you'd like to see us speak on in the coming days and weeks, and then just so that you sort of know where to find us again next time. So someone notified me, Jane, I guess our email announcement went out and had incorrectly put that this was at 4 p.m. Eastern time today. So we got to change that where that went out. Is that we're going to keep this the same time and the same Zoom link. So tomorrow is the ACEs Aware one at the same time. And Jane, where are we going to put a link to that on our blog about this event series?
Yeah, we'll do that.
Okay, so you all can go find the blog for this event series on acesconnection.com and find the link for tomorrow's ACEs Aware if that's something you're interested in. I think it's kind of geared more toward providers. Is that right, Jane? It's for practitioners, and mostly for practitioners, but I think also people in the network of care. So okay. I think it's for everybody. It's really focused on things that I think will be, some things will be universal. Awesome. So that's tomorrow, same time, but not through ACEs Connection. But we're going to kind of defer to that one since it's so relevant and just happens to be the same time as ours. But you can catch us here in this same Zoom room at the same time. So 12 noon Pacific time, 3 p.m. Eastern time. And we will be updating the blog post about this event as we go and as we add different people to come and talk about some of these topics that you have all expressed interest in. So we want you to know that these talks are open to anyone. Feel free to invite people to join us. Yeah, we're so grateful that you're here and discussing these important ideas. And we hope to see you tomorrow and Thursday and Friday. Jane, anything to add? No, I'm sorry for the mistake about the time, but we'll definitely correct that. I apologize about that. But thanks for coming, and
And we'll have one of these soon that is just seeing how we are and how we're going to motivate through this, because I think that that's still resonating with people as we're adjusting to all this. So keep up the good work, stay cool and calm, and thank you very much.
Yeah, and thank you all for all the wonderful work you're doing in your communities. It's so important, and we're so grateful and inspired.
Great.
And Laura, I think wanted to say something real quick.
Oh, just thanks for creating the space, and I'll probably post some of my continuing questions on the Ask the Community.
Great. Thank you, everybody.